Hi YouTube, this is my first video. My name is Rin. I'm 25 years old. I'm a non-binary person living in Seattle, Washington. I've lived here for about 4 years, and in the last 4 years I've grown a lot. I've learned a lot about who I am. I've established like a place that feels like home finally, that feels safe, where I feel loved and accepted, and I've done a lot of healing from trauma in my past. I come from an abusive household. I was sexually abused by my father from a pretty young age, and lost my mother in a plane crash a few days before I turned 15. And just, it was a really horrible experience throughout my high school years. I honestly was very isolated. I didn't have very many friends. I had like one very good close friend who I'm still friends with. I call him my little brother. Jason, hi, if you're watching this. But other than that, I was really, really isolated and didn't think that I was gonna live for much longer. I didn't really have any plans for the future. I wasn't trying hard in school. I was in honors and AP classes, but I wasn't trying hard to do my homework or keep up with my studies. I would go to school and I would contribute when I was in class, and by the graces of my instructors was given opportunities to like bring my GPA up to a point where I could actually graduate with the rest of my class. But it was only because of their help and their understanding that something was amiss, and they weren't really able to do much for me. And so after I graduated, I moved to Arizona, where my sister lives, and I lived there for a couple years. And I grew a bit there, but I was still floundering. When I was in high school, I felt very isolated, up until about senior year, when I knew that I needed to like reach out to other people. I had failed suicide, and I knew that life and living was better than death. I knew that I had more chance alive than I ever would dead, so I might as well stick around. So I knew like end of junior year, beginning of senior year, that I needed to kind of quote get with the program. I was living in the Midwest in Michigan, and up there queerness is not really an open okay thing. So I subscribed to my assigned gender roles. I started wearing dresses, makeup, developed an eating disorder that continued to last for a few years, lost a bunch of weight, and instantly was treated like a human being by my peers. It just reaffirmed that that's what I needed to do to be loved. That's what I needed to do to fit in and have a place in the world, was, be the pretty girl that I was supposed to be. But it didn't last too long. I got up to Seattle eventually. I followed an ex-girlfriend up here, and it turned out really great. I mean, the relationship didn't last, obviously, but the place has been really good. I live not far from Capitol Hill, which is a very queer center of Seattle, and just like all types of people are there, and there's just so much more culture and understanding and openness. I've been educated by people out here in ways that I didn't even know that I needed to be educated. And I think there's a lot of that in the US, and I feel like just that the whole progressive vibe out here is really, really good, and I'm in a safe bubble, and I realize that, and my heart goes out to other trans people that are not in the same kind of safe space that I am, and have to be very incognito about their identity. And then the non-binary people in places where you get completely erased. I feel erased here in Seattle, even though it is so progressive. I think the whole idea of being a non-binary person is kind of incomprehensible to some people. They don't get the fact that you don't feel definitively male or definitively female. They feel like, so many people feel like, well, what will I call you then? How? But like, if you're not my sister, then what will you be? You're not going to be my brother either? No, I'll be your sibling. There are gender neutral terms out there. They do exist and they can be used. And it's so important that when somebody expresses a non-binary gender identity to you, that it's respected and appreciated. And that you be open to the idea that some days they might feel way more masculine and be more male presenting and want to have male pronouns used with them. And then other days they'll feel extremely feminine. People change day to day. People have different moods, different vibes. Like, sometimes you want Chinese. Sometimes you want, like, pizza. Who knows? It's not everybody lives in the black or white. And why would you, like, that's my thing. I can't live in the black or white. I'm polyamorous, I'm pansexual, and I'm non-binary genderqueer because I just want the best of everything. I just want to experience it all because life is so short. And why limit yourself to one avenue of experiences or one avenue of living a life and say, well, I can't do those other things because those are for X gender or Y gender or whatever. Like, that's just so ridiculous. Anyway, that's a whole other spiel. To each their own. I mean, if you do have your preferences, that's totally understandable. Like, everybody has their preferences. Just don't knock on me because I like everything. Like, I just like everything. So, whatever. Anyway, the reason that I would kind of lump myself in closer with the trans masculine crowd is because I am going to start hormone therapy. I actually just had my like blood draw today, my initial intake with my new general practitioner doctor, what are they called? I don't know, like your physician of choice, whatever. And she's really awesome. Her name's Jessica Rongich, and she works at Capitol Hill Medical, and it was just a really great experience. I went in, I gave her kind of some of the background that I gave you, and yeah, I'm like super excited to start my journey, but it's an informed consent clinic, which is a little bit different than like some other places that you would go through. Like, a lot of like general doctors that you can go through will have a whole process. They'll tell you that you need to go to an endocrinologist, and that endocrinologist will tell you that before they can prescribe you hormone replacement therapy, you have to go to a counselor and visit with them like anywhere from like 3 to 12 times to establish that you are a transgender individual, you are a good candidate for HRT, and if necessary, like, and if that's something that the patient desires, a good candidate for top surgery. I intend to do both, so I feel very much closer to the trans-masculine crowd than, like, assigned female at birth, non-binary, genderqueers, you know, more female-bodied, non-binary people. I want to be a more male-bodied, non-binary person. And the reason that I want to maintain a non-binary identity, even though my body is going to be transitioning to a more masculine form, I actually don't want to stay on hormones indefinitely. I actually intend to come off of them at some point to like mitigate the change. I don't want to grow like a full thick beard on my face. I will get facial hair, and I'm fine with that. Like, I'll probably get like some chin stuff going on. That's fine. I can fill it in with mascara if I want to make it look thicker and darker. But I'm not interested in passing as like an adult, fully like manly male guy dude thing. I'm sorry, I'm so awkward. But yeah, so And I say that I'm masculine of center, not binary. Sometimes I'll say trans because I feel like I fit more in a, I fit like kind of between the non-binary and trans category because I am changing my body on a biological level with hormones and also on physical level with top surgery. I don't intend to get bottom surgery if I do stay on hormones long enough, if I feel like that's something that I need to maintain to continue presenting in the way that I feel comfortable with as time goes on, then it's advisable for me to get a hysterectomy. I wouldn't call that bottom surgery personally because I don't want anything done to what's between my legs. But internally, if it's safer for me to remove my uterus or whatever they use, remove the ovaries, then I would do that just because it's safer. But that's a whole other barrel of fish I'm not even going to get into. So at an informed consent clinic, they don't make you go through all that bullshit, basically. They don't make you go to anywhere 3 to 12 sessions of counseling. They don't send you to an endocrinologist, or at least mine didn't. It's all done in clinic. They did my blood draw there. The same doctor that did my blood draw is going to prescribe me testosterone. She's going to tell me what dose to do it on. Typically, they have you come back in and do injection training, but I am a diver med tech, so I know how to do intramuscle injections and sub-Q injections. So I'll be fine with that. I've done them before. I've done them to myself. It's not a big deal. It's super easy. That's something else I want to talk about too. I didn't tell my doctor this. Probably should have. But I got testosterone for myself. I'm not going to say how. I'm not going to inform anybody on how to get testosterone illegally. Because I did. I went out of state, or sorry, out of country, to get mine. Shouldn't have said that. But I don't mean that I physically went out of country. That would be kind of bizarre. Anyway, and I didn't get testosterone that's suspended in sesame oil. Most of the testosterone that trans men and transmasculine identifying, masculine center non-binary people like myself, if there's others of you out there, please find me. Because I'm starting to feel like a really weird fish. Yeah, it was the testosterone propionate, very fast acting, and I was doing low doses. I was doing a 25 or 0.25 milliliter, which is approximately 25 milligrams, testosterone every 5 days, which is super low. And I was doing it at such a high rate because it is so fast acting. It peaks at 3 days and then drops rapidly off. So by the 4th day, I could feel that it wasn't having the same effect. I did notice some changes. My voice got a little bit deeper. It probably doesn't sound any deeper now because I've been off of it for like 3 months. I was on it for 3 months as well. So not very long, especially on such a low dose. Didn't really have much changes. I grew a little bit more facial hair, which still grows in. I have to shave it. Otherwise I just pull on it and it just hurts and agitates my chin. So it's just better for me to shave my chin at least. I don't shave my mustache really because it's cute. It's blonde. It's fluffy. I look like a little teenage boy. Whatever. I'm proud of it. And did have a little bit of bottom growth. It really wasn't much though. It wasn't really a marked amount. I noticed it. I don't think my partner noticed it. Anyway, that's stuff that we don't really need to talk about. But yeah, so informed consent clinic. I didn't tell them about the testosterone. And I'm going to tell you what, just don't do what I did. Don't try and do it illegally. Don't try and get pills from somebody. Don't try and find a trans guy that will, you know, dose you with his stuff. Like, go to your doctor. If you're underage, talk to your family. If they're not going to help you, try and talk to a relative who can act as a guardian to go to a doctor, you know, or just wait until you're 18. It's not too late. You're still very, very young when you're 18, and the changes will be totally normal. You'll be just like any other guy. Nobody will know the difference. Seriously. But do it safely. You need to have blood work done. It's so, so important. Because if you have a thyroid issue, it can lead to cancer problems and cancer scares. Like, just don't mess around with this stuff. Blood health is so important. I thought I was being smart and, like, outsmarting that, like, I know better. I have some medical training. I can... No, I can't measure blood levels. I can't make sure my liver is safe. No. Go to your doctor. See a real physician. Somebody that's an endocrinologist that is trained to prescribe hormones, and get their medical professional help. Period. That's the only safe way to do it. Okay, so informed consent clinic, back to where we are going with all of this. I got this form after my blood draw. You can see at the top it says informed consent form, blah, blah, blah. What does it actually say? Informed consent for testosterone therapy. For female to male transition. So, I mean, masculine, whatever. It's not quite my language, but it'll work. So this form refers to the use of testosterone by a person who wishes to become more masculinized as part of a gender transitioning process. Your initials of the various statements on this form indicate that the risks, as well as the changes which may occur as a result of the use of testosterone, have been explained to you and that you understand them. If you have questions or concerns about this information, you are encouraged to take the time you need to ask for clarification, read, research, talk with staff, and think about potential effects of this treatment before signing. Okay, with the age of internet, I'm sure many of you, like myself, have done tons of research. You know what kind of changes are going to happen. You've seen the pictures of people's bodies changing on the internet because people are really, really, really good about documenting their changes and sharing them in a very candid and honest and accessible way on the internet. That's how I figured out that this is something that I need, is seeing other, transmasculine guys going through these changes and it being very affirming and positive for them and being like, I can see and relate and understand, like, I want those things and I would feel so good to not have a chest anymore, like, feeling a lot of compersion for trans guys and realizing, like, I wanted those things for myself, too. But my doctor did do a really good job. She, like, went from head to toe on what can change and what potential dangerous side effects are, because I didn't think that there were many, but there are a couple. They're not super severe. Like, if you're a healthy, normal individual, you don't have, current blood issues with, like, diabetes or thyroid, you're pretty much in a safe zone. It was really good. I can go through this word by word, but basically I don't really want to go through it word by word. It's basically like the first section is the changes that are permanent to your body, such as your voice dropping, body hair growth, some hair loss if you're an older, I noticed that my hairline did change. It got more boxy on the side here. This part was not here. It was a round hairline before, but it's boxed out now. And it's like way more defined than I thought it would be for being so blonde. And this receded a little bit on the sides here. So, and that's where my dad, and I look a lot like my dad, has balding pattern is backing on the sides. But you can see I have a pretty far back hairline anyway. So I did have a little bit of recession of the hairline, but that all stays. So if your hairline recedes and you grow facial hair, that's, you know, even if you stop hormones, if you've gotten to that point, those changes are staying. Same with your voice deepening. Also with bottom growth. Usually that stays around. There has been some reports of it, like, you know, regressing a bit, but not often. Other things that won't be permanent, which would be the reason that I would probably go back on or want to be back on testosterone at some point in the future, if I did stop, would be the redistribution of fat. So if I did have top surgery, well, like when I do have top surgery, I'll have been on testosterone for a little while, and I'll have redistributed some of the fat that's in my chest now to other parts of my body, or just lose it, because I'm going to be working out, preparing and getting my chest muscles ready and built up for a more masculinized chest when I do have top surgery. And so if I do go back, or if I do stop testosterone at some point and fat does redistribute to that area, is it going to look like, what is it going to, am I going to look like a chubby guy because my chest will be, like, I'm not sure about that. So I'll have to be, like, very mindful of my weight, obviously, if I go off of testosterone at any point, just for my own personal health and, yeah, positive feelings about myself and things like that. Additional changes increase, like, my muscle mass will decrease, apparently. Acne would probably go away. I might have my menstrual cycle come back. I guess some people don't, if it stops when they're on testosterone, and then if it comes back, if they do stop using testosterone or stop doing their HRT, that sometimes it doesn't come back, which I think would be great, but I don't know. And so the rest is just like, I understand exactly what the effects are on fertility, because it can make you infertile permanently. So, like, if I was concerned about wanting children in the future that were genetically my children, I could have my eggs harvested and frozen before doing treatment. I don't want kids, so that's whatever. My sister had the kids and they're adorable, so I'm happy being an auntie. Acne will probably go away, yeah. Oh, I already went through that part. Brain structures are affected by testosterone and estrogen. So it says, the long-term effects of changing the levels of one's natal estrogen through the use of testosterone therapy have not been scientifically studied and are impossible to predict. These effects may be beneficial, damaging, or both. That's just basically saying that, like, there hasn't been a whole lot of studying done on transgender individuals. Surprise, surprise. That to say the, like, what the long-term effects of testosterone are, especially in your gray matter in your brain. So it's just saying, like, you realize that those tests don't exist, but you're still willing to use this for the effects that you desire. The next one is, I understand that everybody's body is different and that there's no way to predict the responses, what my response to hormones will be. I also understand that the right dosage for me may not be the same as someone else. I further understand that I must follow my prescribed regimen of testosterone treatment to continue to receive hormone therapy at this clinic. So that's basically saying, like, I can't up my dosage myself, which I won't. My, you know, copay isn't super expensive. Like, it's just worth it for me to be safe and do it the right way. Number 5, I will have a complete physical examinations and lab tests periodically as required to make sure I'm not having an adverse reaction to testosterone. and to continue good health care. I understand that this is required to continue testosterone therapy at this health center. I have been informed, so number 6, I've been informed that using testosterone may increase my risk of developing diabetes in the future because of changes in my ovaries. Number 7, I understand that endometrium, the lining of the uterus, is able to turn testosterone into estrogen and may increase the risk of cancer in the endometrium. Not having periods may increase this risk. Continued pelvic exams and cervical cancer screenings are strongly recommended unless there have been removal of the ovaries, uterus, and cervix. Important. Number 8, I understand that testosterone therapy should not be relied upon to prevent pregnancy. Even with cessation of periods, the use of a barrier method birth control is advised during sex where semen could enter you. Yeah. I understand the effects of testosterone therapy by itself will not provide protection from sexually transmitted diseases, which, like, why would it? The effects of testosterone therapy do not provide protection from cervical or breast cancer. If you get top surgery, then you don't really have to worry about breast cancer, but there is a slightly higher risk for people using testosterone because, say you're having slightly too much testosterone, the excess will get turned into estrogen, which can then lead to like uterine, ovarian, or breast cancer. It just raises it because your estrogen is higher, so it just raises your potential for it a little bit. What is the other one? I understand fatty tissue in breast and body are able to turn just basically what I just said. I've been informed that testosterone may lead to liver inflammation and damage. So that's what I'm saying. Like, you want to go to your doctor and have blood levels checked because it's, you know, good for your liver. Your liver is very important. So drinking heavily and doing testosterone is probably not advised by most doctors, I'm sure. Let's see. I have been informed that if I take testosterone, my good cholesterol will probably go down and my bad cholesterol will go up. This may increase the risk of heart attack or stroke in the future. So the risk is similar to that of natal males for FMs, I guess. So for me, my grandfather had a heart attack. He did not live a healthy lifestyle, though. He smoked cigars and drank heavily and didn't get any exercise. He was a big barrel-bellied guy and just, yeah, very, very unhealthy and died pretty young because of it. From a heart attack on his boat, so in Florida. So not a bad life, I guess, but I get a lot of cardio exercise. I do have a weakness for bacon, though. I can't lie about that. I love bacon. So I'm probably going to have to not eat so much of that because of the high cholesterol. And just like it's a high carcinogenic food, so it's just not smart to eat as much as I have been, especially if I am going to be doing HRT. I understand testosterone therapy may cause changes in my emotions and mood. Providers can assist me to find support services and other resources to explore and cope with these changes. So I was talking to my physician. So I'm a very empathic person, and I don't cry very easily when things are super sad for me. Like, I just want to fix things and help people feel better and try and empower them and help them find ways to get themselves out of that dark place and feel inspired and hopeful. But when I see something that makes me feel inspired and like gooey and just like, oh, I don't have any control over my tear ducts. I just start pouring out of my face. I'm not even like actively crying. My eyes are just like leaking tears uncontrolled. It's so ridiculous. It is over the dumbest commercials. It's so ridiculous. So I hope that will change. And she assured me that it probably will. So I'm not too upset about that, but I am also planning on probably doing some therapy alongside HRT and, you know, the transition that I'm going through with my identity. Just because I'm going to be like I was telling my doctor, like, I don't really have any depression. I've done a lot of healing over the past, like, 5 years, 4 years of being out here. Establishing, like, safety and community and feeling loved and stuff has really given me the space to, like, heal and learn to love myself better, take better care of myself, and be kinder to myself, be more positive and affirming towards myself. Um, and, but I still have a lot of dysphoria with my body. And my eating disorder, like, clung on to that dysphoria for a long time, and just would, beat me over the head, like, inside, with just horrible, horrible things, saying horrible, horrible things to myself. And so sometimes, like, I do a pretty good job, like, mitigating it, but, like, it's just, even if I'm not actively having those thoughts, like, I still have, like, this deep knowledge that I'm not comfortable in my body, and this deep feeling of, just wrongness with my shape, mostly in this area, from here to here. Like, it's because I'm female-bodied. I'm so female-bodied. And for a long time, I thought it was just weight. I would, starve myself, and I got very, very thin, but still was not happy with my body. So I know that, like, dysphoria also has led me to, like, kind of rub up against some of the trauma that I've been through, and the pain, and feelings of abandonment that I've experienced in my life, and just the, things that I thought that I had healed pretty, wholly from, that I had, kind of wrapped up into nice little containers and said, okay, like, I understand that, I've made my peace with it, I've let go of the anger attached to those experiences, and I've forgiven myself, and I've forgiven others, and, like, it's okay, like, I'm okay with those things. And then all of a sudden, just being very scared of abandonment, and being very scared that I'm not going to be loved anymore, being very scared, and, like, kind of remembering that pain and that feeling that I had when I was younger, of just not fitting anywhere, and afraid that that's going to happen again as I change, and just, like, just the things that are, that dysphoria, and, big changes in identity, and, like, coming basically out of the closet and loving yourself better, and, like, making more room for who you actually are in your heart, for yourself, and in your actual world, with the people around you, and the relationships that you have, and the way that people treat you, and establishing your identity with them, and letting them know exactly who you are, and how you want to be seen and treated, and yeah. So I know that I'm going to do some therapy, and I would advise others to do the same. My doctor gave me a great list of people, and, like, highlighted a few that she thought would be good for me. And yeah. Next one, let's see. Yeah, number 15, I agree that if I have any adverse reactions or side effects to testosterone, I will inform my healthcare provider. So if I'm having, like, spotty bleeding or something like that, if I'm not having, like, irregular, functions down there, then I should tell my doctor. Number 16, I agree to tell my provider about any non-clinic hormones, dietary supplements, herbs, recreational drugs, or medications I might be taking. Sharing this information will help my provider to prevent potentially harmful interactions. So it was 3 months ago that I was on testosterone. I haven't had any side effects since then. Like, a lot of the changes that I did have, some of them reverted, some of them haven't. But I don't think that's going to have any effect on my treatment at this point. Number 17, I agree to take testosterone as prescribed and to inform my provider of any problems or dissatisfaction I be having with my treatment. I understand that if I take too much testosterone, my body will convert it into estrogen. So that's about like dosing. Don't dose yourself. Don't up your own dose. You're not a doctor. I'm not a doctor. I thought I was, but what do I know? I could have hurt myself. Okay, 18, I understand that there are medical conditions that could make taking testosterone either dangerous or physically damaging. I agree that if clinic staff suspect I may have any condition that could be dangerous to me, I will be evaluated for it before the decision to start or continue testosterone therapy is made. 19, I understand that I can choose to stop taking testosterone at any time. I also understand that my provider can discontinue treatment for clinical reasons. And then, so what she asked me to do was to read through this, initial all of them, which I haven't done yet. I'm going to do that probably after I'm done with this video. And then not sign it. She said to wait until I come back into the clinic to actually get my prescription from her and us talk a little bit more about if I've had any change of heart or if my intentions have changed at all. And then we both sign this. She writes my prescription. I go and pick it up. I would usually come back in for injection training. I won't need it. She'll just tell me what my dose is and I can start. She'll tell me what my dose is and how often. So I don't know what her call is. I think they have to wait for lab work to come back to kind of make those decisions. I don't know how she usually functions, but she's, you know, really big in the community out here for trans patients, and she's helped a lot of people that I've talked to, and like people that I know that know people that go to her, and like my fiance actually was a patient of hers before her practice moved to its new location. And she actually remembered my partner, which is fucking amazing because you know she sees a bunch of people like all the time. So it's not like, anyway, and it was 2 years too. 2 years since she had seen Charlene. But yeah, she also gave me Hormones Guide for FTMs. You might have seen something like this online. I've seen this online. I've already read this whole thing before online. It's like basically out of a textbook, I think. Like, what is a typical dose? Chemicals, brand names, starting doses. Like, these are just kind of like standard, you know, things to expect. I can put a link to this information under my webpage because this is already 40 minutes long. I am amazed if you're still with me at this point. Thank you. You must be captivated. I don't know. But yeah, so it was really good information. Informed consent, I think, really is the way to go. Less money, less time, less bullshit. Like, if you're an adult and you have some sort of gender variant identity and you feel that you need hormones to present this way or present the way that you're feeling, and you know how to read, I think that you should be able to go to an informed consent clinic where they tell you, okay, these are the expected effects. This is everything we know. These are the things we don't know. These are the, what will the benefits or the changes that you'll experience. These are the dangers, or some of the downsides, potential downsides even. And that if you feel like that's still, after getting all this information, that it's right for you, that you should be able to do that. I absolutely believe that. I mean, especially if you're paying for your own insurance, like if it's coming out of your paycheck, or, you know, taxes too, like, come on. Anyway, so I feel like everybody, you know, it's no trouble for cisgender people to, like, say who they are, because it's accepted. It's a given, you know. Whatever. That's a whole other thing. But yeah, so I'm gonna sign all this once my lab work's done. I'll have another appointment. I'll go in. We'll both sign it. And then yeah, I'll probably have my first shot posted. I get to do it at home too, which is cool, because I don't need to go for injection training. So I can just do it here at home like I was doing it, in the way that I'm comfortable with. Because some people like fucking shove their needles in. I don't know why, but I have to do mine slow. I have to like pop it through the skin, slide it through the fat layer, pop it through the fat layer into the muscle, and like get it, you know, down to the base of the needle. But I do it like pretty slowly. Maybe I'm a freak. I don't know. Needles don't bother me though. They never really have. I'm probably just a freak. But yeah, so I'll probably have a video of me doing like a weird, slow, and uncomfortable injection for my next video, and celebrating my tea birthday, because I kind of already have a tea date before when I was injecting myself, but I don't feel like, for the changes, or lack of changes, I should say, that I experienced, it's not going to be nearly as relevant and meaningful as this date will be, because this is really going to be the start of my new identity and me getting closer to top surgery. So yeah, I'll keep you guys updated. Thanks for listening. Bye.